Hi, Jamie. Thank you for joining me. And I made it on time. Alrighty. I can't get hired because they want 2 years of experience. I went to school. What can I do to help? All right, Susie. We'll talk about that tonight. Hi, Yvette. Thank you for the blue hearts. That is something that happens a lot, unfortunately, Susie. And I will get into the why, and I will get into what you can do about it. I talk about it a lot on my channel. I think it's like gonna be a staple for every show lately. Is why that happens and what you can do. So hopefully that will help. I will leave the link for another video I did about it. And when you have some time, you can check it out. Come on, you know that's not the one that I want. There's another one. Where is it? Not what I want. I don't want that one. And I'll talk about some other things that you should know as well. Come on, I want the one. There. Oh, shoot. Come on. There we go. This is a link I'm going to leave in the chat box here. Copy it for later. Hi, Jamie. Thank you for the blue hearts. Hi, Ellie. All right. So, since we are on time and we've got plenty of people, let's go ahead and get to it. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight, I am going to be talking about going from risk adjustment or HCC coding to procedure coding. I am also going to be talking about the differences between inpatient and outpatient coding. I know I said that I was going to be doing that on a separate episode, like on Tuesday, but I got to thinking about it, and it sounds a lot like today's episode, so I just want to put it all into one whole episode. And then I will get to a question that I got on here about jobs. So let us begin. All right, HCC or risk adjustment coding. What is this? A lot of brand new medical coders start off in risk adjustment coding because there is no procedure coding. A lot of times they're not even asking for the people to be certified. I've looked at risk adjustment job postings, and sometimes they're not even asking for a certification. They just want you to have a high school diploma or a GED. So that is a good place for brand new coders to start off. However, I will say don't get stuck there, because if you get stuck in coding HCC or risk adjustment, you are only doing diagnosis coding. You have nothing to do with the procedure coding, and that can stunt your growth as a medical coder. Now, risk adjustment is a good place to get started, make connections, but it is when you're starting off and you want to be a full-fledged medical coder, meaning that you code both diagnosis and procedures and E&Ms, you want to make this just a stop. This is not a permanent place for you to grow roots, okay? You really do want to try to move on from that once you get your experience. And the reason that I say that is because when you are a medical coder, you don't want to be just pigeonholed to just only knowing how to do a certain thing like risk adjustment. And risk adjustment, again, you don't have to be certified to be a risk adjustment coder. A lot of times when I'm looking in these job postings, because I'm looking at these job postings, folks, and I'm seeing what they're asking for. And a lot of times, again, they're not even asking for the person to be certified, which is frightening, because you really do need to know what you're doing with these codes and what these codes actually mean when you are doing risk adjustment coding. Now, what is the difference between staying there and then moving on and trying to get into a clinic, or trying to get into a specialty, or trying to work at a facility that you can code all of that, the procedures and the evaluation and management? It's up to you. It's your responsibility as a coder that even though during your day job, right, you're just doing the diagnosis coding, you still need to practice with the workbooks for the procedure coding. There's no excuse to fall behind in learning how to do the procedure coding. If you say to me, well, Blue, you know, I got my certification, I got a job in risk adjustment, I've been doing risk adjustment for about a year, but I feel like I've forgotten how to do the procedure coding. There's nothing that says that you have to stop studying, okay? And you don't have to study long, arduous hours either. You just need to make some time every week so that it stays fresh in your mind. And I have many, many recommendations on the workbooks that I talk about for you guys when it comes to workbooks for practicing on procedure coding. So whether you want to go into the outpatient side or the inpatient side procedure coding, you still need to make sure that you are studying whichever one you want to get into. It depends on what your certification is. If you hold an outpatient certification like the CPC, right? You're going to want to stick to the CPT coding, okay? Because that's going to be your outpatient coding. I want to make sure I said that right. But yes, if you have an outpatient credential, you want to stick with that. If you want to start learning like the inpatient stuff because you've been risk adjustment and you've seen how it goes, it's really going to depend on the employer if they're going to even take a chance on you if you hold an outpatient certification like the CPC or the CCSP. So really, it just depends. But your best bet is if you hold one of those, is that you're going to stick with the CPT side. Again, you can use the workbooks, continue to practice so that you don't get rusty when it comes to, well, I've only been experienced doing the diagnosis coding, but I have still practiced. So when you do take those assessment tests for the other positions that you apply for, you're going to understand, you're going to have some grasp of what's happening when you are looking at those, because they will test you on your knowledge. They want to see where you're at. And depending upon where you're going, if you're going into a specialty or whatever, that may be what they test you on in that particular CPT specialty area. But it doesn't necessarily mean that. It could also be a variety of things. When I worked at home a few years ago, I worked for a level 1 trauma hospital. And when I got my assessment test was 50 questions. I had cases in there and I had basic anatomy questions and questions about the book. And it was on everything. I had moms, babies, OBGYN. I had traumas, which I enjoyed those because I'm really good at injury coding. So it's not something to be fearful of, especially if you've gotten away from it. Just get right back into it. It will come back to you as you start to get in there. But there's nobody that's going to hold your hand on this part and say, well, you need to do this and you need to do that. Would it be great? Yes. Does it happen? No. So that's why it's on you folks. If you are an HCC right now and you want to get into that procedure side coding, the E&M side of coding, and don't be afraid of it, then you've got to put yourself in that position to be able to do that. And you've got to put yourself into that position where you're going to be able to recall those things. And once you do, you'll be able to get there. So what is the difference between inpatient coding and outpatient coding? So inpatient coding, you still using the ICD-10 CM book. That is our diagnosis book. And that applies to both inpatient and outpatient. The rules are different though. So on the inpatient side of the house, you are using the diagnosis book, and the procedure book is called the ICD-10 PCS. So that is this book here. This is the 2020 book. Yes, this is the Optum 360 ICD-10 PCS book. This is what they use on the inpatient side. This is just a publisher that I prefer. There's tons of different publishers when it comes to these books, but of course I trust Optum 360. Now, this is not an ad for Optum 360, although if you're watching, call me. But they get their codes out of that book, okay, on the inpatient side. If the patient is staying in the hospital, and you're coding for the inpatient side of the house, that is the book that you're going to be using. It's different when you're coding for the prophy side. Prophy is something completely different. I'll talk about that in a minute. But on the inpatient side, you're coding things that are what the doctor is treating. So sometimes when a patient is admitted, they don't know what is wrong with the patient. So they may have a bunch of different things that they are treating them for, and they'll say that they're treating them for rule out pneumonia, so that you're going to select pneumonia. But on the outpatient side of the house, We have to go with a more definitive. We have to go with what is actually true. What do we know to be true? If we don't know if the patient has pneumonia, then we're going to pick up the signs and symptoms, right? Or whatever else they say. So that's what you're going to do on the outpatient side of the house. But on the inpatient side of the house, you are going basically with whatever the doctor is saying that they think that the patient has until they come up with some diagnosis, okay? And that's what you're going to be taking care of on that side. But yes, inpatient coding is a little bit different in the fact that they have those different rules, and you are creating the codes. The codes that are in the ICD-10 PCS book, the procedure codes that are in here, you have to build these, and there's different rules about building them. There's the approach, there's the intent, and there's a lot of different things that comes with coding that. There is no evaluation and management for the inpatient side of the house. That is the trade-off, okay? But it does not mean that it's going to be so easy, okay? And a lot of people will say, well, it's maybe 2 or 3 charts per hour, and that's what their quota is, 2 to 3 charts per hour. It doesn't necessarily mean that it's easier, okay, or that it's less work. 2 to 3 charts per hour means that you're looking at the patient's entire stay, as opposed to the outpatient side where you are just looking at whatever the patient is being treated on that encounter for that day. That's the difference between the two. Now, on the outpatient side of the house, of course, and of course on the inpatient side, one more thing, you are going to be using the HCPCS book, HCPCS level 2, they use that as well. On the outpatient side of the house, we are coding things that are more definitive. We are coding what is absolutely we know to be true. We do not code things that are probable, suspected, likely, maybe, all right? We don't do that. We code what is definitive. We use the, of course, the ICD-10 manual for our diagnosis coding. We use the CPT manual, and that houses both your evaluation and management codes and your procedure codes. So all of the procedure codes are already built. You don't have to build them. You're not sitting there trying to think of the approach and think of the intent and changing the letters and the numbers. It's already built. So that is the beauty of the outpatient side. It's already built. And there's people who have different opinions about which side is easier. To me, it really all depends on the individual and what how they have been taught and what they think. And of course, we also use the HCPCS level 2 book as well on the outpatient side. So really, when you're looking to have more options for like where you can apply, the CCS, or the gold standard of medical coding credentials, the certified coding specialist, is a credential offered with the American Health Information Management Association. This one credential is the gold standard of medical coding credentials. When you're looking at these job postings, a lot of times you will see that they're asking for the CCS, and that is because this is the mastery of the inpatient setting and the outpatient setting coding. So if you have that, you can go anywhere. You can apply for inpatient positions, you can apply for outpatient positions. So it's going to give you more of a range. Whereas if you have a credential that is just on the outpatient side, you're going to be, on the outpatient side. Sometimes though, in facilities, they will allow people who have outpatient credentials to be cross-trained into the inpatient side. And then it is up to them to get their certification or whatever, what have you. Some will actually make it to where they'll help pay for that, but it really all depends on the facility themselves. But that is the big differences between the two. I've talked about that many times, what the differences are. So I hope if you have any other questions on that you'll look at some of the videos that I have. A lot of the videos that I have are inspired by you all and your requests for topics. And so I have a lot in there about jobs, about interviews, about resume tips, what the difference between inpatient and outpatient coding is. And I talk a lot about just different things and even some of the modifiers, and I've got some other things about the coding as well. So just take the time to look through my videos. And like I said, I have well over 600, but there's something in there for everybody. So let's get to the comments. Hi, Destiny. Hi, Marissa. Thank you for the blue heart. Hi, Guy. Guy are back. I know who I am. Hello. Hello, Guy. Hi, Aurora. Jamie says, I study every day. Hi, Liz. Thank you for the blue heart. And Ellie, is there a ratio how many cases to code? Are you talking about production standards? I've talked about that too in other episodes where production standards for the inpatient side and the outpatient side are different. I have seen on the outpatient side the range anywhere between 80 per day average to 150 average per day. And that's on the outpatient side. And then, of course, on the inpatient side, I've seen it 2 to 3 charts per hour. But again, it's going to be different everywhere you go. Now, don't panic if you're looking in the outpatient setting and you see that their average is 120 per day. Don't panic, because they're not going to expect you to get in there and start immediately coding 120 in a day. Okay, so don't think that. They will give you a ramp up time. And before anybody asks me, ramp up means they're going to give you time to build up. Sometimes it is 60 days, sometimes it's 90 days. And then they will see where you're at from there, because they're going to give you time to learn the system and learn the process of how to code and things like that, as far as like in their system, not exactly how to code. As one of my former leaders used to say, when you get a job in medical coding, it's not the employer's job to train you how to code. You should already know how to code, especially when you've passed the certification exam. Now, I understand that there's a lot of people who struggle with this because they say that their school taught them basically how to pass a certification exam and that's it. And they say, well, you'll learn on the job. Again, it's upsetting, because a lot of these schools will push through these people and they'll take your money and they don't care if you understand or not. And so that's why I say a lot of the studying is going to be on you to have to ask questions, or for you to speak up if you don't understand something. And there's been some people who have written me and said, well, Blue, I tried to ask my instructor and they got mad and they yelled. You know, some people have no business being an instructor. And some people are an instructor because that's all they can get a job at. You know, they've had experience or whatever, and for whatever reason, maybe they just code slow or whatever. And so they become an instructor. And that's why, you know, so there's a myriad of reasons, but not everybody that's an instructor knows everything. Okay. And not everybody that's an instructor is going to teach you those critical thinking skills. And some are held to those standards of wherever they're working, and they say, well, no, you will only follow this script and you will not deviate from this script. So they're going to do whatever they're told to do, because that is what they were instructed. So I mean, I would always hope that you guys have an instructor that promotes that critical thinking. I didn't have that when I was in school. A lot of this stuff that I know is because I have had to spend time with the books and learn it. And it's something that you have to accept, and especially if you find out that you're in one of those schools that they just took your money and they don't care and they just want you to get in and get out. And so they have your money. And if you find yourself in that position, it's okay. Don't take it as a defeat. Just get as much as you can get from them as far as like material wise to learn things, and go on and make sure that you are putting in the time, because nobody can do that but you. Nobody made me a high caliber coder but me, right? I had my support along the way, yes, but at the end of the day, I'm the one who's doing the heavy lifting. I'm the one who's actually looking at the books, reading the books, going through the books, going through the exercises. And that's what you have to do too. And there's tons of free resources out there, guys. There's Just Coding. This is not an ad for Just Coding, but Just Coding has a free subscription and a paid subscription. JustCoding.com, right? And they have practices for diagnosis coding, for procedure coding, the inpatient and the outpatient setting. So you can go there and get these practices for free. And I've gotten complaints from people who said, well, no, they were too easy and I was able to whip through those and, you know, I was really bored. You're not supposed to look at the answers, folks, right? The idea is to practice and give yourself something to work with. So that's why you don't want to sit there and look at, oh, it's multiple choice, let me just pick and go through there. No, cover up the answers and look the answer up in your book, and then see if your answer matches one of those. So that way you can get the practice. Because if you're looking at the answers, that's not helping you to learn. You need to learn how to look things up in the book appropriately. And so that's my advice on that. You know, that's what I can say there. To get to Susie, her question was, I can't get hired because they want 2 years of experience. I went to school. What can I do to help? Here's the thing. Everybody says they want experience because, quite frankly, employers can be lazy. Yes, I said it. They can be lazy. If they have a choice between somebody who has experience and somebody who doesn't have experience, they're going to pick the person who has experience. But the person who has experience doesn't necessarily always work out because they don't necessarily always know what they're doing either. You can have 2 years of experience working in one particular clinic, but if you didn't do anything else and you didn't try to learn anything else, that 2 years of experience does nothing when you go to another position and you can't code, right? If you haven't been applying yourself. So there's that. So the thing that I tell people is, don't be discouraged when you see that they want 2, 3 years experience, 5 years experience. Go ahead and apply anyway. And the reason that I say to go ahead and apply anyway is because everybody who has experience in your area that's a medical coder is already going to be in a job. If they want to move jobs, of course, then they'll be applying for the same position that you are. But it doesn't necessarily count you out. Again, you have to be able to pass their assessment tests. So if you are doing your practice, if you're practicing, you should be able to pass those beginner assessment tests. And then number 2, if your resume looks good, you are more likely to be picked up than somebody who just put together a resume that kind of looks like everybody else's. Well, Blue, I don't have experience. You don't have to have experience. What you do have is training, brand new training, and you don't have any bad habits for your new employer to break. So that's something that is a selling point. That is something that you can say, I am newly trained and I have this knowledge and it's fresh in my head. I know the coding rules, I know the guidelines, and I'm very familiar with them, versus a veteran coder who not all of them will do that. Some veteran coders are guilty of not rereading the coding guidelines. The coding guidelines get updated every year. So whether it's a minor change or a major change, they still get updated. And some coders do not take the time to reread those guidelines because they think they already know. So that's where you can kind of pull ahead and be like, well, I already know these guidelines. So again, your resume and your cover letter have to look good, and it has to showcase all of your talents and your skills and everything. And I tell people when they, because I do resume reviews, but there is a charge for this. I can't review resumes for nothing, because if I did, I would get inundated with resumes. And I used to get inundated all the time until I started telling people I have to charge. And then all of a sudden I stopped getting resumes because it's impossible for me to go through that many. And again, I work a full-time job. I have 2 channels. I do tutoring and I do resume reviews. So that my time is very, I got to be careful with it, because I never want to put out something that is lacking in value because I'm tired. Okay. So when the thing that I can say about these resumes, and the thing that I see the most from brand new people, is they always say, well, I don't know how to say this, so I'm not really good at writing. You need to get that out of your head. You are good at writing. Believe it or not, everybody is. And there's so many programs, so many writing programs that are out there that can help you. So the fact that you may think that is really not an excuse, because if you have all of these word programs that'll help you, it'll get you moving in the right direction. What you need to say in these cover letters, because people will have a resume but not a cover letter, you need to have both, okay? A cover letter is going to not be a regurgitation of your resume. That's number 1. I've seen that, and it's like they already know. The resume is supposed to be about you. That's going to be the draw of like, oh, hey, this person sounds interesting and I want to meet them. I want to interview them because they sound like they're good, or whatever the case may be. That cover letter needs to say, why do you want this position? Why would you make a good fit? What is it that has been in your past that's going to make you a really good medical coder? Or what is it that you understand and know about their facility that you think will be good for them about you being there? And if you're bilingual, put that down. I've seen so many people neglect that. And when I go through and I start updating and I put on there that they're bilingual and everything, boom, is when they start getting calls. Okay. Because having that skill is another skill that you can, what, we're on the same wavelength, Ellie. But it's something, when you have that skill, when you're bilingual, or even if you're a polyglot, right? You are valuable in the fact that you don't know who that doctor's office or that hospital is servicing. What population are they servicing? Now, if you are bilingual, okay, well, we know we have a coder back here who's bilingual. Yes, I mean, it may just be something minor. It may just be that the fact that you have this skill that will set you aside, set you apart from everybody else. So that's something to think about. You got to showcase all your skills, because they don't know you from Adam or Eve. So they want to know what is it about you. And in that cover letter, that's a good time to talk about that. In your resume, just stating the facts. Just state the facts. And be very specific in your resume. Please, whatever you do not put, I was trained in ICD and CPT. Congratulations. ICD what? When I see ICD or ICD-10 and it's not complete, it makes me crazy, because we have ICD-10 CM and ICD-10 PCS. You cannot assume that the employer is going to know automatically that you mean CM or PCS. And not only that, a lot of times this is going through a reader that's going to look and see how many of these words do you have that is matching the job listing, because it's got to go through the gatekeeper. And that little machine that reads your resume, that's the gatekeeper. Okay, this person has all the skills that we are looking for on to the next phase. So it's going to go to the person. The person's going to be able to look at it. And if your resume is showing that you put in some effort and to be to the point, don't use extra words, a lot of extra words, including but not limited to. Get rid of that. If that's in your resume, get rid of that. I'm a team player. Get rid of that, because those are filler words. It's just making your resume look bloated, really. I'm going to be honest with you guys. If I'm trying to help you all out, okay? You can look on my LinkedIn page where I have gotten some feedback for my resume writing abilities. So I'm telling you guys this so that way you guys know. Get to the point. Don't use a lot of extra words. And when you're listing your skills, do you know how to use a Microsoft Office, Outlook, Word, Excel, PowerPoint? Put that on there. If you know how to, of course, you have all of your training, your ICD-10 CM, ICD-10 PCS if you went through that, CPT, HICS, PICS. What else did you learn? Medical terminology, anatomy. These are all skills that need to be on your skills list. If you are neglecting this, it's wrong. If you are saying I was taught in diagnosis coding and procedure coding, that's wrong too, because diagnosis coding and procedure coding is not going to get picked up like ICD-10 CM, ICD-10 PCS, and CPT, and HICS PICS. Those will get picked up. Did you have any training with any kind of encoder software, 3M, or any of those things? You need to put that on there. Did you have any of those kind of trainings? Were you, did you have an internship or externship? What did you learn there? Put that on your resume. That's supposed to be on your resume as well. So, and don't think just because, well, I worked at a Dollar General, and that has nothing to do with coding. Well, no, but there's some transferable skills here. Okay, you do have where you can interact with people, you can diffuse situations, and when you are working with providers, you have to be able to have that skill. You have to be able to have good interpersonal skills. You've got to be able to speak and write clearly, and they're going to be able to see that based on your resume. And then, of course, you have when you're working in those kinds of places, if you're using an Excel spreadsheet, that's where you're going to have that on your skills list. If you've used Word, again, it's going to go on your skills list. If you are coming from being a nurse, don't make your resume look like you want to be a nurse again. Put the things on there that you know is going to transfer over to being a good medical coder. Understanding of anatomy, medical terminology. And what did you do as a nurse? You helped with the vital signs, of course, but the review of systems back when they had that. Now it's different now because evaluation and management changed, but you can still put that down on your resume. So there's things that you can transfer over that I think a lot of people are sort of overlooking, and you don't want to overlook these skills, folks. The resume should be no more than 2 pages. No more than 2 pages. If your resume is 3 or 4 pages, that's too long. They don't want to see that as something that they're looking at, okay? Now, 2 pages is sometimes necessary because when you're looking at like all of the things that you have done plus all of your skills, it is going to fill out to 2 pages. 1 page, of course, is always ideal, but there's not a whole lot of space that you can work with on 1 page. So 2 pages is just as fine. No, you do not need to be IT certified or experienced. This is not, medical coding has nothing to do with computer software. Nothing at all to do with computer software. So if that's what you're thinking this is, it's wrong. Medical coding has to do with records. Medical records, medical documentation has nothing to do with being IT. IT is something completely different. If that's what you're thinking that's the wrong profession. This is medical coding, not software coding. Okay, so that is something that you should know. So, but does that answer your question? I don't know if she's still with me. Are you still with me, Susie? Did that answer your question? That you still need to apply anyway? And there is those alternative jobs as well. There's medical billing. You don't have to be certified to be a medical biller. And if you're walking up in there and you have your certification in medical coding, that puts you ahead of the pack, right? Because you know and understand all of the rules. When it comes to why they're getting denials, you're going to be able to understand that because you know the rules of medical coding, right? So the other one is prior authorizations. Prior authorizations is going to, you're going to get a note from the doctor and say, or a chart from the doctor. And it's going to say, I want to do this procedure on this patient. They have this condition. Call the insurance company and see if they'll pay for it. The insurance company kicks it back and says, nope, this diagnosis does not support this procedure. It is on you to go through the documentation and see if there's a supporting diagnosis for this procedure. So that is something else that's going to get you exposure to codes, and it'll help you to make that transition a lot easier to get into coding. Okay, so sometimes you may have to start off in an alternative position, but it'll still get you to where you want to go. And sometimes people have that all or nothing type of mentality. Well, I went to school for coding and that's all I want to apply for. In the ideal world, the medical coding field would be a lot more welcoming to brand new people. And that's the thing, that the message that I always share on my channel is that if you are in one of those leadership programs that you're going to go into, RHIT or RHIA, that you take the time when you are in those positions to say, we are going to welcome brand new medical coders because we need to change the culture of this mishigas of, oh no, you need to have experience, because it's BS. To me, in my mind, it's BS. It makes me mad because I think a lot of places are losing valuable talent. And I know there's people that are trying, and I know there's people that really want to do this, and they're not being given equal chance, so that's the thing that I'm saying. And it is very hard, but it is not impossible. It just takes time, finesse, and a lot of knocking on doors. You can also apply with temporary agencies in your area. Now you can Google temporary agencies for medical personnel, and a lot of them will pop up, and they'll have the different positions for LVNs, LPNs, nurses, doctors, and for medical billers and coders. That was how I got my start. Did I want to start off at a temp agency? No. But I ran into the same problem that everybody did. which is not having any experience at all, and then trying to apply everywhere, getting those tests, and then they're saying, oh no, you passed, but we can't hire you because you have no experience. And again, to me, if a person just passed your test, there's no better person, right? to get in there than somebody who passed their assessment test. But whatever, you know. But anyway, when it comes to that, so I called the school, and the school was like, well, I have a friend who owns her own temporary agency, and she can put you with the job assignment. And the more job assignments you get on, the more that you will have to fill out your resume. And that assignment was only for 3 months, and they had 3 of us there, and they were going to pick one of us to stay at the end of the 3 months. I didn't get picked, which was fine because it ended up working in my favor. I got way more money at my next assignment, but I had to move. But I got way more money working at that next assignment, and then that led me to where I am today, which is in a very good position. I work in a wonderful hospital with a lot of really good people, and I love where I work because when it comes to what I do, I don't think that it's work. But I had to go through all that just like everybody else. And we all went through it. And it's just something that it shapes you in the beginning. Because once you have experience, then you'll be able to go anywhere. But in the beginning part, yes, it is hard. But a lot of factors go into it. You really have to take the bull by the horns and really go with it. When it comes to the rejections, you got to just smile and say, okay, this is preparing me for the next one. This job was not meant for me. I meant for another place. When I didn't get the job to stay in my hometown, was I bummed? Of course. But my mom reminded me, that means that position was not for you. And she was right. Of course, moms are always right. And so when I went to my second position and I was applying for the position that I'm in here, I had applied for a lower position. And initially, and I had gotten the interview, everything went great. I only had about 8 months of experience, and I was still thinking I was going to be able to get into this position. I was like, oh yeah, I'll be able to get into it. And I did the interview, everything went great. I was like, oh yes, I'm almost home free because I was very far away from home, and I wanted to be home more than anything in the world. And this place was going to get me a lot closer to being at home. And when I didn't get the first call, you know, of course I called my mom. I'm crying because I didn't get it. And she told me the same thing. That position was not meant for you. Just wait. It's not your time yet. And so I said, okay. And I felt better, but I still was like very determined. I'm going to get there. I'm going to get back there. And sure enough, within a few more weeks, the position came open again, but it was for a higher position. And I applied for it. And everybody told me, oh no, Blue, don't do it. You won't get it. I said, what's the worst that could happen? They see my name again. I'm back. But if they reject me again, they reject me again. I mean, I never got a call that I was not accepted, but I never got the call when the initial interview was so promising. So the second time when I applied for the higher position, which was more money, I got it. Just like that when it closed. And so that there's a lesson there. I was determined and I was not going to give up. Did I cry? Did I get mad? Yes, of course I did. I'm human just like everybody else. And I get scared, I get worried, but I don't let that bog me down. You can't. When it comes to medical coding, yeah, you can't let it bog you down. You have to be determined. You have to say, okay, I'm getting knocked down, but I'm getting right back up. You have to get back up. Because if you don't, you're going to, all that time that you spent, all that money that you spent is wasted. And it's for something that you want, you'll go after it, and you're not going to let anything stop you. So try getting into those alternative positions. Try getting into, still applying for those medical coding positions. Just keep applying because they don't know that you exist unless you put yourself in front of them with these resumes. Ed says, I worked in outpatient facility coding for years now, finding that productivity requirements have gotten much, much worse and unrealistic. And see, that it goes back to our ethics. And in our ethics, we can't be forced to meet these unrealistic demands. I saw one Somebody said that they code for the ER and they have a 320 a day quota. I was like, are they for real? 320 encounters per day? That's ridiculous. Nobody can do that. Not have accuracy. There's no way. So to me, there are some that I have seen that have been very reasonable. There are some that I see that are ridiculously high. For those that are ridiculously high, I wouldn't even mess with those, because they're going to have high turnover. They're going to have unrealistic standards. So they're going to have unrealistic accuracy standards as well. If you have really high productivity standards, then what are you going to do? Lower the accuracy standards? That's not right either, because according to our ethics, we have to code appropriately, and we cannot be forced to code inappropriately. So you need the time to be able to absorb what you see. And sometimes people think, well, you know, they're doing a lot of the computer assisted coding. So that is what is keeping that is what it can raise the productivity standards. Not so. Even with the computer assisted coding, people get that misconception that, oh, all of those codes are correct. And when in actuality, when you go back and you look at it, they're not. So that is something that when people are not responding to that, to those high ridiculous levels like that, that's when things kind of start to turn around the other way. At least hopefully they do. But you can't maintain ridiculously high standards and then expect people to still do really well. You know, to me, it would not be worth it to be in a place like that. I would not. If having experience, I would not waste time in a place like that. And even if I was brand new and trying to get my foot in the door, I still wouldn't waste time, because at the end of the day, you're still culpable for everything that you code and what you select. And we can just as easily have our credentials taken away for inappropriateness of coding. So no, it's not worth it. It's not worth it, at least to me. Like I said, there are places out there that have better standards and better productivity, more manageable productivity than others, because sometimes the people that are really high tend to be the ones that are like the contract coding companies, or that they say, well, we'll give you X amount of money if you get through this fast. No, it's never worth it to go fast and have poor product at the end, because then you're going to have to pay for it to be redone. At least that's my opinion. And not only that, there's always fines for coding inappropriately when they get audited. So some of these people, I don't know what they're thinking sometimes. At least, I don't know, it's like whatever. Because some of these places, they're just, and you know, my facility is fairly high for accuracy. We are at 97% accuracy. The average is 95. I've seen it as low as 90%, which if you get to 90%, that's very low. That's not really wanting a lot from your people. So that you want to make sure that you are kind of watching your accuracy. Accuracy at 95 is I would say about average, and that is fair. But again, it all depends on how many records are being audited as well. If you have a very low number, obviously, any one mistake can hurt you, and that's really not a true reflection of the coder and their abilities to be able to code. Again, if you are coding 2,000 encounters per month, and you only get maybe 15 of those audited, that's again not a true reflection of what you're doing. So that is just my opinion on it anyway. But yeah, there's a lot of things out there that are just, it's not right. And when I see some of these people, this foolishness that some of these employers try to pull, it's like, come on, man. No. And I see the way that they treat their people, and it's just like, no, that's not right. And I've seen people that have written me, and they're brand new medical coders, and they say, well, Bleu, I had this interview with this company, and here I thought I was going to be like, they were interested, and then the lady literally got after the lady because it was like, Why do you think that you should have this position? You don't have any experience. Well, you knew that the candidate didn't have experience before you interviewed her. So why are you wasting everybody's time? And see, that's I would have walked out. If it was me, oh yeah, I would have walked out. Because there's no reason to be that way. You know, a person is looking for a job, and everybody needs to think back to the time when they were brand new coders and they were going through that. So, I don't know. I'll get off my soapbox. But hopefully that answers your questions about how to go from diagnosis coding to procedure coding. Make sure that you are still practicing with the book. Make sure you're using websites like justcoding.com so that you can practice. Get some workbooks. The workbooks that I recommend are going to be in the description box below. Are you serious? Kung Fu Ken says, one time I interviewed for a medical billing position and the interviewer didn't even know what revenue cycle was. That's sad. That's sad. That is really sad. Because as somebody that's already doing the interviewing, really, they don't know what, yeah, I don't know. Oh, and I was going to talk about profi coding. So I know I kind of jumped, but I didn't want to wrap it up without completing what I was going to say. Profi coding. If you ever see a position looking for jobs and you see profi coding or professional fee coding, that is when the patient is staying in the hospital, right? But it is not entirely inpatient coding that you're doing, right? So the patient is staying in the hospital, but another specialty provider comes up and visits the patient, and they have to get paid for their professional fee service. So let's just say, for instance, that the internal medicine team admitted the patient, and they say, oh yeah, well, they seem to have a diabetic foot ulcer, so we need to consult the podiatry team. So the podiatrist comes up and sees this patient that's under the internal medicine team and says, okay, yes, well, we're going to do this treatment, that treatment, this treatment, that treatment. So for that podiatrist to get paid for their professional fee service, that's when the pro fee coder comes in. So they're going to say, okay, well, we have that they saw them for this, and this is their level. The levels is going to be different. You will see them in the book under let me look. I don't know why I blanked. I know the code range is 99221. What is it? How is it listed here? Whoops. I haven't done profi coding since my early days. And initial hospital care and subsequent hospital care. That's what the codes fall under. So yeah, that's when you're doing profi coding. That's what it's going to fall under. So just so you know, it's still considered outpatient coding, right? Because you are using the CPT manual, but it is that the patient is physically in the hospital, but you will be using the CPT manual, not the ICD-10 PCS manual. So hopefully that will clear that up. But yes, I've addressed a few things tonight. One being the going from inpatient to outpatient. And then what the differences between inpatient and outpatient are. And then, of course, talking about resumes and how can you get a job. I see that a lot. That's a common thing I've been seeing lately. And I think because there's so many new graduates. And I'm seeing it all over LinkedIn as well. And I'm on LinkedIn at Medical Coding with Bleu, so if you want to join me there, you totally can. And it's just, I just want to tell people, just keep going. Just keep applying. Don't give up. Please don't give up. Don't let that time be for naught. All the time that you spent studying and whatever else you had to do in order to get through that time. You know, don't give that up just because just a few people told you no. You have to put out a lot of resumes. You got to put out a lot of interview time out there as well. So at least that would be my recommendation. If you can't get into medical coding right away, try medical billing, try risk adjustment, try prior authorizations, try the medical records department. At least medical records is not coding, but it will get you around the people that are going to do the hiring for the coding, because then they'll say, well, I know so-and-so has their certification and we need a medical coder, let's transfer them in-house. You know, that's always an option that you can go through. So tomorrow's episode is going to be about how to stay motivated while you're studying for your certification exam. I've seen a lot of the people that have been writing me lately, Blue, I'm not motivated and I got my exam coming up. How do I stay motivated, guys? We're going to talk about it tomorrow. So I'm going to go ahead and wrap this one up. If you haven't had a chance to like this, please like it, subscribe, share if this helped you, and I will see y'all on the next episode. Bye.